ఇంటర్నేషనల్ కాంగ్రెస్ అకాడమీ ఆఫ్ క్లినికల్ ఎంబ్రాయిడలిజిస్ట్ సదస్సుకు హైదరాబాద్ వేదిక అయింది. హైదరాబాద్ హెచ్ఐసిసిలో 2 రోజుల పాటు జరిగిన ఈ సదస్సుకు దేశ విదేశాలకు చెందిన 300 మందికి పైగా వైద్యులు హాజరయ్యారు. పిల్లలు పుట్టని దంపతులకు ఐవీఎఫ్ శస్త్రచికిత్స ద్వారా మంచి ఫలితాలు పొందొచ్చని, నార్వేలో 1994లో ఐవీఎఫ్ ద్వారా మొట్టమొదటి బేబీ పుట్టిందని ప్రముఖ వైద్యులు ఆర్నీ సుండే తెలిపారు. ఈ సదస్సులో ఆయా దేశాల్లో జరుగుతున్న శస్త్రచికిత్స విధానాలు తెలుసుకున్నామని చెప్పారు.
Thornhill, and I work for Igenomix. I have a laboratory in the UK. I've been very kindly invited to come and speak at the ACE conference in Hyderabad this year. I'm really excited to be here. And two things I'm going to be talking about. One is quality management in the IVF laboratory, how to improve things by using a systems-based industry-type approach. The second thing I'm going to be talking about is something very important. It's for ladies going through IVF who want to improve their chances of getting pregnant using PGS. And some of the results that we get from PGS are very simple to interpret, and some are more difficult to interpret. And I'm going to be talking about how we can help people with those more difficult results. That's mosaicism. Well, I'm not sure PGD and PGS should be given priority over other genetic tests. It depends what those tests are, but I do think that PGD, when used for single gene disorders, is probably the most important and effective way of helping couples to have a child free from a genetic disease. PGS is more about trying to help them have a healthy pregnancy when they go through IVF. So if those are the indications that those particular couples have, then they obviously are the most important tests that they can have. And I do believe that PGS as an adjunct to IVF is probably the most important test that you can have to help you have a healthy child and a reduced miscarriage rate. It's a large investment to do PGD and PGS. It's extra money and extra time and effort on top of doing an IVF cycle. If you're doing PGD for a single gene disorder, it's also important to know that more than 50% of embryos are chromosomally abnormal. So even though you're not looking for that when you first start doing PGD, you have to consider it. So one of the reasons that PGD cycles fail is because the chromosomal abnormalities haven't been taken into consideration. So if you add PGS on top of a PGD cycle, you have a much better chance of getting an improved success rate. So now if we handle just PGS on its own, you're already looking for the chromosome abnormalities which you know are there. But not everybody who has a normal embryo put back to the uterus gets pregnant. So why not? Well, there are two main reasons. One reason is that there are other factors, other viability markers that we haven't looked at when we look at chromosomes. And the second reason is the endometrium, so the lining of the womb. Now that has to be optimally receptive and have the right timing to ensure that the embryo can implant, even though it's normal. Well, QMS, or a quality management system, is one of the bedrocks of any manufacturing industry. And although we don't like to talk about IVF and other kind of clinical treatment as manufacturing, it is indeed a manufacturing process, or a set of processes. It's very complex. But to put it simply, you take a sperm and an egg and you make an embryo, and then you transfer that embryo to the uterus. So in that sense, it is a manufacturing process. When we consider that and then many sub-processes involved, we have to use a kind of engineering approach. So we have to use quality management. You wouldn't expect to buy a donut or buy a car without there being a lot of quality management processes involved. So why would you expect IVF to be any different? And there's a lot of evidence that if you use a quality management system in any process, you get improved outcomes. We see that in IVF, and you get consistently good outcomes. Well, it's interesting. The incidence of infertility seems to be growing all over the world. You've just said that in India it's 15 to 20 million couples. It's often quoted by the World Health Organization, 1 in 6 couples. So it's clearly a large problem, and it increases with exposure to different pollutants and so on. So I think that's no different than in India. Can these genetic tests help reduce the infertility? Well, not necessarily, but what they can do is help decide by a diagnostic test what treatment type to use next. They can also help to improve that treatment. I've mentioned PGS and how it could improve IVF once you're working with an infertile couple. But there are a couple of new tests which are very exciting, which might actually reduce infertility by giving a different treatment option that isn't IVF. So for example, we're learning more about the bacteria within the endometrium. And we know that if you have a certain type of bacterium that isn't present or not present in a dominant form, there's a lower chance of implantation. Well, maybe improvements in that test and understanding more about that test could lead to therapies before IVF. And so in that sense, we could decrease the infertility.